Hi, my name is Ben Johnson and I'm Associate Director of Clinical Strategy at Medscape Education Global, based in Amsterdam, the Netherlands. On behalf of my co-authors, I'd like to thank the organisers and the Scientific Advisory Board for the opportunity to present this poster as part of the virtual presentations for the Alan Moorman Memorial Fund European Cholangiocarcinoma Conference in 2022. Today, my presentation will cover the value of continuing online medical education and improvements in competence and confidence of both gastroenterologists and oncologists in a case-based discussion focusing on the integration of molecular-guided therapies for the treatment of advanced cholangiocarcinoma. Here are the disclosures of myself and my co-authors, and to note, this educational activity was produced by Medscape, but the outcome study and the medical education program was supported by an independent ethical educational grant from Insight. In this poster presentation today, I'll run you through the educational rationale and the design of this activity, including the overview and the format, how we approach the methods and statistical analysis for the outcome study, some of the key results from those outcomes, and then any conclusions and future educational needs that we have drawn. Continuing medical education, or CME, activities serve as a means of professional development for physicians and healthcare professionals in their services provided to the patients, the public, or elsewhere in their profession. Through outcomes reports of medical education activities, we are able to determine baseline levels of knowledge, assess the impact across learners across the activity, and understand also the areas that are important to address in the future. This educational activity forms part of an ongoing curriculum and builds upon a need to understand the shifting clinical situation in advanced intrahepatic cholangiocarcinoma. Through past medical education activities in advanced cholangiocarcinoma and landscape analysis, we have determined the following educational gaps which were to be addressed during this project. These include the need to improve awareness of emerging clinical data for targeted therapies in advanced cholangiocarcinoma, understanding the approaches to identify eligible patients for targeted therapy, and then also applying some of these targeted strategies to clinical practice in different scenarios. This activity was designed to address these clinical gaps, and 2 learning objectives were also included. These were to improve the competence of participants in their ability to identify patients eligible for molecular targeted therapies, and also to improve the competence of participants in the application of molecular-guided therapies in routine practice. A 30-minute case-based roundtable discussion with synchronized slides was utilized as the format for this educational activity. 3 faculty members, Joachim Mertens, Teresa Masarula, and Lorenza Ramassa, discussed a number of varied clinical scenarios with advanced cholangiocarcinoma and helped develop the content for this activity. Conversation focused around highlighting clinical approaches to decision making, including when and how to utilize molecular testing, how to effectively interpret the results, and then also align targeted treatment to individual patients. This educational activity was available to be accessed by Medscape members from the 27th of September 2021. Today, I will present the educational outcome results based upon the Moore's educational pyramid from the educational activity that were collected in the first 3 months until the 11th of January 2022. These results cover the responses of 40 validated oncologists and 32 gastroenterologists who completed the entirety of the activity, including all pre- and post-activity assessments. Educational effect was assessed using a repeated pair design with pre-post assessment, known as a linked learner assessment. 3 multiple choice questions assessed competence, and 1 question that rated on a Likert type scale assessed confidence. Unlike aggregate measurements, where all learners are grouped into a single pre- and post percentage, a paired method of sampling allows for a robust analysis of the learner base at the individual level. And this can be determined by either question or learning objective, and you can see from that the learners who have improved their knowledge or competence, those who have reinforced a pre-existing level of knowledge or competence, or those who require further education, i.e. they are unaffected by the educational activity. Statistical analysis for the overall average number of correct responses and for confidence ratings were conducted using t-tests, and a McNemar's test was used to determine significance at the individual question level. Considering the results as a whole across the activity, statistical improvements were observed at the aggregate level for both gastroenterologists and oncologists, with a Cohen's d score of 0.6 and 0.73 respectively. These indicate a moderate positive marker of educational effectiveness in both specialties based upon the sample size and the paired data. In addition, 56% of gastroenterologists and 40% of oncologists improved their competence across all of the assessed questions in paired analysis. To assess the impact of education on achieving learning objective 1, which focuses on identifying patients eligible for targeted molecular therapy, learners were asked to determine the most appropriate next step for a female patient identified with advanced intrahepatic cholangiocarcinoma as determined by a CT scan and core needle biopsy. In the paired analysis, 81% of gastroenterologists and 8% of oncologists were able to determine the correct approach, which was to refer the patient for further diagnosis confirmation and next-generation sequencing. Of these correct responses, improvements were seen in 25% of gastroenterologists and 15% of oncologists when comparing the pre- and post-activity assessment questions. Learning objective 2, regarding the application of molecular-guided therapies in routine clinical practice, was assessed through 2 pre-post clinical case questions, where learners were asked to determine the appropriate second-line therapy in patients based upon molecular testing results. Across both questions, aggregate results statistically improved by a relative change of 69% in gastroenterologists and 29% in oncologists. In paired analysis, 47% of gastroenterologists and 30% of oncologists improved their competence on this learning objective across both questions in the post-assessment. Through a prior study on the educational pathway published in 2020, it has been noted that improvements of or reinforcements of both knowledge and competence are significant predictors of changes in confidence. And through confidence, they also influence the intent to make changes in clinical practice of learners. That is why we included confidence assessments in our pre and post questions, and self-assessed confidence regarding requesting the right molecular testing for patients with newly diagnosed advanced cholangiocarcinoma was assessed on a Likert type scale. Learners were asked to rate their confidence prior to the educational activity and following completion of the entire activity on a 1 to 5 scale, ranging from not confident through to very confident. Overall, 47% of gastroenterologists and 45% of oncologists had a measurable increase or shift in their confidence. Most improvements for gastroenterologists were noted in the reduction of those who specified they were not confident, a score of 1, which reduced from 50% in pre-assessment to 22% post-assessment. For oncologists, large improvements were seen in a number specifying that they were mostly confident, a score of 4, which increased from 5% in the pre-assessment all the way through to 30% of oncologists in the post-assessment. Overall, online continuing education is effective at improving competence of both gastroenterologists and oncologists in the areas of patient identification for targeted therapies and the application of these therapies in advanced cholangiocarcinoma. These improvements in competence are linked to improvements also noted in confidence of the physicians in their ability to request the right molecular test. This was also highlighted by Professor Masarula as of crucial importance, as it indicates that the physicians are recognizing the importance of next-generation sequencing in cholangiocarcinoma. As medical education is an ongoing continuum, it is important to continue to develop professional knowledge and competence, in particular in the interpretation of clinical data, utilizing the testing results to guide treatment decisions, particularly as part of a multidisciplinary team or as part of a molecular tumor board, and then also managing these patients while on emerging targeted therapies. Again, I'd like to take this opportunity to thank the organisers and Scientific Advisory Board for accepting this abstract and for being able to present these results. Thank you very much.